Hi guys, welcome back. In today's video, we're going to talk a little bit about SIBO controversy around whether or not levothyroxine or synthroid might actually cause SIBO. Stay tuned to find out. But first, a little bit of backstory. So in 2017, there was an article that came out titled "Levothyroxine Therapy and Impaired Clearance Are the Strongest Contributors to Small Intestinal Bacterial Overgrowth." And that is a pretty bold title to say right in the title that levothyroxine and impaired clearance are the strongest contributors. So it seems like it's a pretty sealed deal, done deal from the title of that paper. And naturally, a lot of people, both in the nutrition space, the SIBO space, and in my profession in functional medicine, a lot of people started posting that these drugs were bad, these drugs were causing SIBO, ha ha ha, drugs are bad. And I really do not think we can draw that conclusion, even from an article with that bold of a title. So that's kind of the article that, in my opinion, started this controversy. And I think it's leading to some really dangerous advice. Even today in 2021, I am seeing people post on Instagram and social media and in Facebook groups saying point blank that levothyroxine and synthroid are causing SIBO, and it is freaking people the F out. Because what is a person to do? If you are sitting there and you see this post and you have hypothyroidism and you are on a medication to treat that, and you also have SIBO, and chances are you're desperate to get rid of SIBO, what are you going to do? You're left with two crappy scenarios then. If your medication is indeed causing SIBO, the question becomes, well, do I get off the medication? And if so, how does that even happen? Or am I just doomed to have SIBO forever? And I really don't want to send people down on that spiral, A, because I think it's unnecessary, and taking away the medication might actually make you feel worse and impair your ability to heal from SIBO further. So let's kind of hash this out. We'll talk about the mechanism and why this even became a thing. And then, of course, we'll talk about the real reality. We'll connect the dots to make a lot more sense out of this, because there is some useful information to take away from this correlation, but it is not that levothyroxine or synthroid cause SIBO, and it is not that you need to get off of your medication. So first and foremost, let's go over to my really beautiful anatomically sound depiction of the human digestive system. So recall, if you will, from numerous videos, food goes in the mouth, goes down the esophagus, winds up in the pouch that is the stomach. Then it goes through the small intestine, the longest part of your digestive system. And then eventually it'll wind up in the colon and make its exit through the anus. So normally in a person without SIBO, you are chock full of bacteria from about the beginning of the colon to the end of the colon. And the rest of your digestive system has a light smattering of bacteria. There are bacteria, there are yeast, there are viruses. It's just that they're not nearly in the same quantity as resides in the colon. But for a person with SIBO, small intestinal bacterial overgrowth, there is an increased quantity of bacteria in part of the small bowel, whether it be here or here or here, that's up for grabs. But there's an increased quantity of bacteria somewhere in the small bowel, and usually the ratio between the good and the bad bacteria is askew in those people as well. So we have an increased quantity and a dysbiosis in the small intestine in folks with SIBO. And I added something to my beautiful depiction today for you guys, which is the brain, kind of a big deal. And remember, one of the things that we talk a lot about on the podcast and on this channel is that the brain, okay, this isn't going to be super anatomically sound, but just go with it. The brain is going to control the gut and tell the gut what to do, primarily via the vagus nerve. And those vagal nerve fibers go all the way down to the beginning part of the colon. So from the throat down to about the first third of the colon, that's all vagus nerve territory. It's all under the direction of that one nerve. But nonetheless, all of the functionality, all of the secretions, the motility, the contractions, the perception of pain, all of that is under the influence of the nervous system in some way, shape, or form, whether it be the vagus nerve or like the sacral plexus or something else. So one of the hypotheses around SIBO and hypothyroidism, because that link has been established before. One of the theories around that is, well, the thyroid and its hormones are necessary for motility, and that's why one of the symptoms of hypothyroidism can be constipation, and a very common symptom of hyperthyroidism, Graves' disease, is diarrhea. So the impaired motility, or motility gets slowed down, so you're not clearing the bacteria out of the small bowel, you're not sweeping those bacteria down like you normally would, and then it allows for a backup. It allows for that overgrowth. So that's kind of the hypothesis right now, is that hypothyroidism slows down motility, slows down the clearance in the small bowel, and then you get a buildup of bacteria. What I would also hypothesize is that the brain really, really likes thyroid hormone. And if you have ever talked to anybody who's hypothyroid, other things that they complain of are brain fog, fatigue, depression, like just a feeling of bleh in their life. So your brain doesn't work as well as it should when you are hypothyroid. So that ends up being a big deal, A, because mental health is important, but B, because the brain is what is controlling the vagus nerve, and it's stimulating the vagus nerve. So if your brain is hypofunctioning, if it's underfunctioning or understimulated, then the vagus nerve is going to be understimulated, and then you're going to have some vagus nerve impairment to go along with all the other fun symptoms of being hypothyroid. And this is why I'm pretty darn adamant when people bring this up that no, they should absolutely not go off their thyroid medication, because it's going to lead to neurological consequences, vagus nerve and motility consequences. You need thyroid hormone to run your metabolism in a lot of ways, but also you need thyroid hormone to heal leaky gut. So if you do have a leaky gut, which is highly likely with SIBO, then that becomes much harder to heal from. It's like you're trying to climb a mountain with a 500-pound backpack full of bricks on it. Like, theoretically, you can get up that mountain and you can heal from SIBO under those circumstances, but you are so weighed down, it's going to be way more difficult than it ever would have been otherwise. So thyroid hormone is very, very important for a lot of the mechanisms that we talk about as far as healing the root causes of SIBO and making sure that you build a body that is SIBO resistant. Now, that being said, in that paper, one of the big whoa moments was that they determined that hypothyroidism, so having an elevated TSH or an underperforming thyroid gland, being hypothyroid itself does lead, or it is associated with SIBO. But levothyroxine, which should be correcting the hypothyroidism, right? Like, it should be treating the thyroid levels so that your TSH and your T4 and your thyroid levels are all normal. But levothyroxine was actually more strongly linked with SIBO than being currently hypothyroid. So what's the rub? If this was the only mechanism that is leading to the increased incidence of SIBO, then the levothyroxine should correct a lot of this. If it's just a straight up deficiency of thyroid hormone causing the slow motility, the altered brain function, the altered vagal nerve function, low stomach acid, difficulty healing the leaky gut, then correcting that hormone level should correct the problem, right? But it's the opposite in this study. Now, granted, it wasn't a huge study, but it kind of makes the wheels and gears turn, and that's where people are starting to get the wrong idea, and they're saying, oh my God, the drug is bad for you, levothyroxine is evil, and I really don't think that's the case. So let me bring you over here to this other drawing. The important thing to know is a couple-fold, is that we all on this channel should know this by now, but in case you don't, about 90 or 95% of hypothyroidism is caused by an autoimmune condition called Hashimoto's. It's not like your thyroid just decides to not work for the heck of it and say, ha ha ha, I'm gonna get them. It's being attacked, it's inflamed, and it's dysfunctional, and it appears to be slacking off because it's been under siege for God knows how long. So in somebody who is hypothyroid, like I'll use my mom as an example, my mom has been hypothyroid since I was about 6 months old, I think is what she told me. And there was no conversation of Hashimoto's. There was no conversation of autoimmunity or managing her nutrition or managing her immune system. None of that conversation until I got old enough to learn functional medicine, and then I started treating her and we correctly diagnosed her with Hashimoto's. But for all that there's a lot of people who are walking around just with the hypothyroid diagnosis, about 90 or 95% of the time that's caused by autoimmunity. So we're just going to be really broad and say that hypothyroid equals autoimmune, just for the sake of simplicity, but acknowledging that there is that 5 or 10% that is not Hashimoto's. So the autoimmunity becomes the really relevant piece of this, and it's where we can connect the dots, because autoimmunity is going to be progressive. It's not like one day you were completely, totally normal, and then the next minute you had full-blown Hashimoto's and you needed levothyroxine. It's not that quick, it's not that simple. It's a progression. And also autoimmunity and immune dysfunction is inherently inflammatory. And it's also reactive to inflammation. So in a person who develops autoimmunity, they might have had dysbiosis or an infection or a lot of stress or a lot of trauma or a toxicity first. And then the immune system reacts to that dysfunction or that deficiency or that inflammation, tries to protect the person, and then accidentally goes after, say, the thyroid. So the progression of autoimmunity, you can think of it almost like stages, but it's not. You can kind of think of it as being analogous to like cancer staging, like stage 1 cancer, stage 2 cancer. But hopefully that doesn't freak people out, but it's kind of a similar idea where stage 1, autoimmune anything, but in this case we're talking Hashimoto's. Stage 1 Hashimoto's is going to be less severe, easier to deal with, and you could possibly prevent further dysfunction if you catch it early, versus somebody who is in like a stage 3 kind of situation. That's going to be much more progressed, probably more inflamed, and it tends to go something like this. The first stage of autoimmunity is just the autoimmune reaction. That's all it is. Again, the person might have had toxic exposure, they might have had a deficiency in a nutrient, a lot of stress, whatever it might be, something perturbed the system. And then one day, one fateful Tuesday, your immune system decides to start attacking some innocent bystander tissue, and in this case, it's the thyroid. So one fateful Tuesday, your immune system starts to take an interest in the thyroid, but you still have 99.999999999% of a perfectly healthy, functioning thyroid gland. So there's no signs and symptoms of the condition. There's no need for a diagnosis yet. Your TSH is perfect. Your T4 is perfect. Everything is hunky-dory, but you have that little bubbling bit of inflammation and you have that autoimmune attack. So for this person in stage 1, if you will, the person is going to have some autoimmunity, but they don't have signs and symptoms. They are not experiencing the brain fog and the fatigue and the constipation and the weight gain and the symptoms of hypothyroidism quite yet. And their TSH and their labs are perfectly normal. And they sure as heck have not reached a diagnosis because there's nothing to really send up the red flag, right? Then, as time goes on, and this is going to be different for each person, for some people, they might make this progression in weeks. Some people, it might be months. Some people, it might be years. Some people might not ever get to the stage 2. But as time goes on, that person will still have autoimmunity, assuming that they did not treat it and really get to the root cause, right? This person will still have autoimmunity, but now they start to exhibit some signs and symptoms, and maybe their labs start to reflect it. So now the person is in this limbo where they're a bit more tired than usual. They start to struggle with some constipation. Their skin and their hair and their nails kind of start to change. They are a bit depressed, but they're not diagnosed with anything. They're just kind of meh, right? And maybe their TSH has gone from a beautiful, 1.10 up to like a 3, right? Like it's not enough that conventional medicine is going to give a shit yet, but it's enough that it's just starting to manifest a little bit of dysfunction. And again, you can imagine the thyroid tissue, maybe this person has had the autoimmunity and the inflammation in that tissue for a while now, and now say 10% of their thyroid gland is inflamed and compromised, and they have about 90% of a functioning gland left, right? Like I'm making these numbers up, but you get the idea. So they have more tissue compromise, more inflammation, more progression of the autoimmune process, and they're going to start developing some signs and symptoms and a little bit of like subclinical lab changes, but it's not going to be enough that it's going to merit a medication yet. And conventional medicine usually is not going to give a crap. Then, same person, let's say we follow the same person for a number of years. Now they have the autoimmunity, again, assuming that they have not treated it yet, or they haven't been aware of it. They have the signs and symptoms, and they have probably gotten worse over the years because nobody has cared yet. So now they are quite constipated. They have gained a lot of weight. They are really depressed and they're on an SSRI. Whatever it might be, their cholesterol has gone up, their skin and nail and hair all stink, and they're taking collagen, trying to fix their hair and their skin and their nails. Whatever it might be for the individual, they have signs and symptoms, and they usually are going to be more progressed by this point. And then finally, it's like, now somebody cares because my labs suck enough. Now this person walks into their primary care or their OBGYN, they get yearly labs drawn, and now they find that their TSH is abnormal. Maybe they have a TSH of 6. And now the doctor says, hey, there's something going on with you. We better give you levothyroxine or a synthroid. Those are the two biggies. And for good reason. They work. They're dirt cheap. Most people do pretty well on them. So this is the person. This person right here, in like a stage 3 more progressed situation, this is the person who has had a prescription for levothyroxine written for them. So these are the people who are in that cohort of the study, but they are also the people who have much more long-standing and progressed autoimmunity, and therefore inflammation, and therefore whatever the root cause was that caused the autoimmunity, that's probably worse now too. So whatever the dysbiosis was, or the deficiency, or the toxicity, or the stress, if that was not managed, that probably is just as bad, if not worse. So now the root causes of the hypothyroidism are longer standing and possibly more overt and severe. The autoimmunity is more progressed, more long-standing, and more deeply ingrained and more difficult to quiet down. They've had signs and symptoms of the dysfunction, of the inflammation, or the hormone imbalance for possibly years and years. Their brain hasn't seen thyroid hormone in who knows how long. They have been, constipated and dealing with whatever else, and their brain has been underfunctioning, their metabolism has been underfunctioning, possibly for years, because they were in this crappy stage 2 limbo area for far too long, but they're also on levo. So are we really going to look at this retrospective cohort study? Are we going to look at that group and say, oh, gosh, golly gee, the levothyroxine cause SIBO? Or are we going to look at the type of people who would need levothyroxine, see the other root causes, see the other dysfunction, and see the levothyroxine as a symptom of that dysfunction? That's how I see it. And that's what was clear as day in that study, especially because people who are hypothyroid but are not on levo have a lower risk of SIBO or a lower incidence of SIBO. So we're talking, in this case, like, all right, this maybe is not going to do it quite justice. Imagine that the people who are hypothyroid, which probably means their TSH is somewhere in like the 4 or the 5 or the 6 range. Let's say that that person is in like stage 2.5, right? So they're real close to getting to the stage 3, but they're not quite there yet. Or maybe we're looking at people with a TSH of like 3 point something. I actually don't know, because the study did not reveal how they assessed and diagnosed hypothyroidism. I think they were just looking at codes for hypothyroidism. So I don't know really how they're assessing that. But I would suspect that the people who are hypothyroid, but they are not on levothyroxine, are going to be somewhere from about, stage 2.5 up. And the people who need levothyroxine and have that prescription in their chart are in this 3rd stage. And that is more progressed autoimmunity, inflammation, root causes that haven't been addressed possibly for decades. And now, of course, those things are going to lead to SIBO. Of course, the thyroid hormone dysfunction plays a role, But remember, for all that the vagus nerve doesn't like being hypothyroid, the vagus nerve also really does not like to be inflamed. So now we have a vagus nerve that's going to be underfunctioning, a brain that's going to be dealing with inflammation and be pretty PO'd on a regular basis because it's inflamed and the nervous system doesn't like to be inflamed. The gut lining itself could very well be inflamed. Maybe this person is now underproducing stomach acid or pancreatic enzymes or bile. Maybe this person was originally dealing with dysbiosis or yeast overgrowth, and now maybe that has gone along with the SIBO. I mean, the possibilities are endless, but I'm painting a picture based on what I've seen clinically. The more inflamed you are, and the more broadly dysfunctional or out of balance your body is, the more likely you're going to manifest things like SIBO, because all of the checks and balances that keep SIBO away start to fail. And, it's like, how surprised are we going to be? How surprised would I be, for example, if my mom was diagnosed with SIBO? So I know she's had SIBO, but how surprised would I be if my mom, who was inadequately diagnosed and just given levothyroxine and nothing else, and who did not know she had autoimmunity, she did not know she had inflammation, she didn't know that she was gluten intolerant, she didn't know that she had deficiencies. How surprised would I be if she then, after 20 or 30 years of being hypothyroid, also got diagnosed with SIBO, as opposed to somebody who just got diagnosed as hypothyroid, or maybe they just started levothyroxine, or maybe they're coming to a functional doctor like me, and I'm pointing out, hey, your TSH is 3.2. That's a little bit subpar. Let's address it here so that you never progress further down this chart. I mean, I'm not really surprised. That's how the body works, guys. So please, 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 if you are a professional, if you're a nutritionist, a dietitian, a functional medicine doctor, a naturopath, please, for God's sake, stop telling people that their medication is causing their SIBO. If you want to have that conversation, talk about PPIs. Don't demonize the thyroid medications. I really, truly do not think that they are causing SIBO. I think that it's just, we're using that as a proxy to look at two different cohorts of people, and the signals are kind of getting crossed. But this, I think, is the real contributor to SIBO, and have that conversation with your patients as opposed to potentially scaring people into going off their medication. So that is my little PSA. I really hope that this gets out to the right people and that this myth goes by the wayside, because it's scary, and it scares me to think that people might be going off of their medication to try to treat their SIBO, when in reality doing so could make them worse. So I really hope this reaches the right people. If you guys wouldn't mind, if you could share this in any of your SIBO groups, your IBS groups, your thyroid groups, that would just be so appreciated. I want to get the word out and make sure that people know this, and that way they can really get to the real work of understanding the root causes and slowing down the autoimmunity and working on the inflammation and the gut dysfunction, and they don't have to get sidetracked with the whole levothyroxine synthroid thing. So thank you so much for tuning in. As always, I'll see you in the next video. Hey guys, if you like this video, be sure to subscribe, ring the bell, click the like button, and leave a comment down below with the videos that you would like to see me do next. Doing all of those really helps support the channel and support my efforts in making as many videos as possible for you guys. Thanks so much, and I'll see you in the next video.